Well, it's Colorectal Cancer Awareness Month, and a New York-based Nigerian-American doctor and health expert is leading the charge to share her expertise on what everyone can do to better protect themselves against this deadly disease. So to tell us more, Dr. Nesochi Okeke Igbokwe joins me live from New York City. I do apologise if I pronounce your name slightly wrong. Thank you very much indeed for joining us. Let's start with colon cancer. I mean, it's one of those diseases that's rarely been discussed in the mainstream compared to other cancers. Obviously, we mentioned the untimely death of the actor Chadwick Boseman. Since his death, did that enlighten the awareness of the disease?
Well, thanks for having me on the show, Mr. Warren. But to answer your question, yes, the death of Chadwick Boseman, it absolutely put a spotlight and highlighted the importance of screening for colon cancers earlier in stages of life. I had so many patients after his death reach out asking me, Doc, should I be worried about my risk for colorectal cancer? What do I need to know about this? Anytime you have an amazing, influential individual who unfortunately succumbs to such an illness, it absolutely shines the light on the illness, and more people want to understand what exactly the disease process is and what can be done to prevent it and the risk factors.
If someone's being diagnosed with it, I know with various cancers, obviously the earlier the better. But how treatable is it? Because some cancers, for example, pancreatic cancer, generally if someone's sadly got a diagnosis, it's sadly a matter of time. How is it with colon cancer?
So it definitely is treatable, and of course, if it is found in the earlier stages, one does have a better outcome when we're talking about colon cancer. When one has a diagnosis of colon cancer, the next step really is going to be a staging process. So based on the tumor size, location, if it's traveled to certain other regions, doctors do what we call a staging. The earliest stage is stage 0, and the cancer can actually progress from stage 0 to 1 to 2 to 3 to 4. Stage 4 is the end stage. That is the last stage of colorectal cancer, and that means that basically the cancer has metastasized. If the cancer is detected during the earlier stages of colon cancer, there are more treatment options.
What can people do to check the symptoms? Are there any common symptoms for colon cancer?
Yeah, so there are some red flag symptoms that every patient really needs to be aware of when we're talking about colon cancer. One thing you need to determine is if you are having a change in your bowel habits from baseline. So if you are somebody who's had very normal bowel habits, and all of a sudden you see and note this change whereby you're having an increased frequency of diarrhea, an increased frequency of constipation. Most certainly, if you notice something like blood in the stool or rectal bleeding, or you notice that you're having this persistent abdominal cramping, also coupled with a weight loss that you didn't intend to have, those are all red flag signs, and those are signs for concern. With that said, some patients who are diagnosed with colon cancers never have symptoms at all. So that's why the importance needs to be focused on preventive measures, preventive care. Basically initiating care with your doctor to determine at what stage in your life screening is going to be necessary. You happen to be somebody who does not have symptoms at all, and you don't have screening. If you did have a colon cancer, unfortunately would likely be picked up in the later stages when you start to develop symptoms. So the key is always move forward with preventive screening, starting at the age of 45, because the guidelines have changed at this point. 45 is now the new 50. It used to be 50 years of age that we started the screening with a gold standard colonoscopy. Now the age is 45.
And the research has shown that there's a disparity with African Americans, that there seems to be an increase amount of people with the disease. Is there any reasoning behind that, or is that still being under research?
So it's definitely still being researched, but we do know there is this disparity that we see in Black patients versus other ethnicities. It could be multifactorial in nature, but we kind of look at a few things. Sometimes it is lifestyle choices in regards to dietary choices. Sometimes the diet that you adhere to, it really can make a difference in increasing your risk for colorectal cancer. So environmental factors like the foods that you eat. If you are one that always eats red meats, processed meats, basically foods that are not so great and healthy for your colon health, that will increase the risk as well. So you have to look at dietary habits. You have to look at other factors such as smoking habits. You have to look at other things such as obesity, the kind of lifestyle one lives, if it's sedentary, non-sedentary. We know a lot of these things increases one's risk for development of colon cancer younger in age. So it might be environmental factors, but it's certainly likely multifactorial in nature when we're talking about this. But certainly we do need more research to determine why we're seeing this increased incidence in the Black population.
Sadly, we'll have to leave it there, but well done and good luck with the continuing fighting of the cause, and we're pleased to play our part in Awareness Month for you. Dr. Nesochi Okeke Igbokwe joining us there from New York.